Gentleman for Ely, Mr. Bosti, recognized for 5 minutes.
Thank you, Mr. Chairman, and gentlemen, thank you for your service, and Mr. Eichelsel and Mr. Downs, Semper Fi. Let me say, if I can, Mr. O'Byrne, can you expand a little bit? Because let me tell you, you're the first person I've ever, in all the time of having this job, and I've only had it through a term and a half, that says they want to reduce the amount of benefit that they are receiving, okay? And I understand your argument that it is, and I believe that you can be healed. I do. But how and where do we make that judgment call, or where does the VA make that judgment call on individuals? How does that happen?
Well, as I started to research it, it's the same process of getting benefits.
Okay.
Which is, I'll go in front of a psychiatrist, psychologist, and go through the same process of saying, here are my symptoms, and here are, how have I improved, how have I not improved, what's my current living status like. So it's all the same process, really.
So as you went through the process of when you first got your rating, do you feel like the VA handled that correctly or incorrectly at the time?
It's hard to say correct or incorrect. I was pretty broken at that time, and so I missed a couple of the CMP exams, and I felt at the time it was unfair, but I'm not sure if I feel the same way now. It's sort of the process that you have to go through. You have to be vetted, and what I talked about with some of the fraud, that has to happen, right? Because there's veterans that they are going to abuse the system if they can. They're going to get a paycheck if they can. And so I think that the system has to be set up in a certain way that you have to go through these steps. I didn't think it was fair at the time, but it's sort of necessary. Yeah.
Okay, and that was a concern I have with your expressing and your situation, but I don't know. Yeah, fraud and abuse occurs, but I don't know how we stop it. You see what I'm saying? Because I don't want, or maybe.
Yeah, if I may. So at Headstrong, we don't require any proof of military service. We don't require any paperwork at all. And if there are people taking advantage of us, our philosophy is that's okay because we have a bigger mission. At the end of the day, the other benefit we have is one of our clients has told us is we don't provide anything but health care. So we don't have that issue of benefits.
Thank you. Another question I have for Dr. Cudler. What do we use through the VA to show either success or failure as we treat post-traumatic stress syndrome patients in comparison, and can we do that in comparison to the private sector? Because I know the studies and all of those that have been done there. As a matter of fact, there's a very successful one in my district is called This Abled Vet, and it works very, very successful, and it actually has 3 university studies proved how it works successfully. What do we do through the VA to know that we're successful in the programs we're putting forward?
Our specialty PTSD clinics on a regular basis will review a very thorough PTSD clinical interview called the CAPS interview, which is sort of the standard in research, and also it's more intense than most clinicians use to assess are our PTSD clinics working. But what we're trying to do, that's only the specialty clinics, those 131, only cover a small number of the veterans who actually have PTSD at different levels. We're trying to develop a new program called measurement-based care. And actually, unfortunately, there's some legislation and IT concerns that get in the way of that. What we want to do is have veterans give us direct input of their symptoms on smartphone apps and in computers. You know how you have the white coat syndrome when you come to the doctor's office and your blood pressure goes up? Then they say, hey, you have high blood pressure. No, I'm just afraid of you, doctor. What you want to do is get people at rest at different times of the day when they're in their normal lives and say, how are they doing? We want to enter that data, but right now there are security concerns with the computer information. You're going to get past our firewall, what viruses are going to follow. We need to solve that problem, and I believe there are technological solutions to that, but we may need your help as a congressional body in getting permission and legislation to collect data directly from veterans. When we have that, then every patient can say to their doctor, how am I doing? And not just in PTSD. but in other problems too, and they can compare that and goes right into the electronic record. That's what we're trying to build. Been working on it for the last 4 years.
Wonderful, thank you. I yield back.
Thank you, gentlemen, for yielding. Ms. Brownlee,